So hello everyone and welcome to the case 25 of this case discussion series, and we'll be discussing an emergency case today. So here we have a 65-year-old female who came with complaints of severe pain in the right iliac fossa since the past 1 month, with frequent episodes of high-grade fever which have started in the past 10 days now. And this is the CCT abdomen done for this patient with oral contrast. So these are the plain non-contrast images. Axial section first, where we can see this is the liver. Normal uh, uh, bilateral kidneys are seen, and there is some mesenteric stranding as well as collection in the paracolic regions, along with a large collection in the pelvic region, which can be seen along with the leakage of the oral contrast within the collection. We can trace the appendix. The proximal part of the appendix is seen with thickened wall. The distal part of the appendix is not seen, and it is merging with the collection. There is also a cystic lesion in the left adnexa with some fat density and calcifications, suggesting a dermoid cyst. These are the post-contrast images where we can see that there is a large collection with leakage of oral contrast within it, and there is an enhancing wall. The distal part of the appendix could not be traced, but the proximal part was inflamed with surrounding fat stranding and thickened wall. The wall was enhancing, hence it was not gangrenous here. So this is a report that I had given, that the collection with irregular enhancing wall was seen in the right iliac fossa and the pelvic region, with oral contrast seen within the collection, which was suggesting there was some perforation in the bowel loops. And since the proximal part of the cecal appendix was seen adjacent to the collection with thickened wall and extensive mesenteric stranding was seen in the right iliac fossa adjacent to the collection and the appendix, it was suggestive of a case of perforated appendix with appendicular abscess. There was also a left adnexal cystic lesion with fat density and some calcifications, which was suggestive of ovarian dermoid cyst. So what exactly is perforated appendix? Perforated appendix is one of the complications of acute appendicitis. When it is left untreated, the wall becomes gangrenous and there is a focal rupture. The incidence is seen more in younger age group as well as patients older than 50 years. And since she was a 65-year-old female, this was a presentation that was seen. On CT is very specific for this, and certain signs that we have to look for on CT are focal defect in the enhancing appendiceal wall, which was not very well seen in this particular case because the distal part of the appendix was not very well traced. It was within the collection. Appendicular abscess is the most specific finding, which was seen very well in this particular case in the pelvic region, the right iliac fossa, along with extraluminal leak of the enteric contrast, which was also seen on the plane images. So here we have to look at the plane images as well for the oral contrast leak into the collection. Also, we can see some extraluminal appendicolith in some cases and some gas foci.